All right, we're recording.
Okay. Okay, so Molly, do you have any comments that you want to make before I kind of jump in and start to ask questions?
None at all.
None at all. Fair enough. Okay, so we've got Chris, we've got me, we've got Maritza, Katie, and Christy, right?
I'm on now. Can you hear me okay?
I can hear you, Katie.
Okay, good.
And Maritza, can I hear you?
Yes, ma'am.
Oh, there she is. Super. Hey guys, how are you?
Good. How are you?
Good.
I'm good. So, can you hear me okay? Am I screaming at you? Tell me.
You sound good.
Okay, good, cool. So I haven't checked in with anybody there for quite some time, so I'm not really sure where everybody is kind of in this process. So I really just wanted to use the first little bit here just to kind of gauge where people are at, what experience have you had in the last 6 weeks, and that'll help me to figure out what else I need to like kind of diagram out and to make clearer for folks. So Chris, have you done any work with MedRefer?
No, the program's on hold still.
Okay, so nobody's taken any calls. So has anybody done any kind of review of materials that were hanging out there, or any of that good jazz?
Mostly what I've been doing is internet stuff. We have some of the folders and stuff that were at your desk, and these were from like I think 2012, so I wasn't sure how much I should use. But I have them. They're there. If you think any of them are still really good and useful, I will dive into those too.
Okay, and well, of course, all the stuff that is on the desk can just be found online, and that's probably better. So right. I guess one of the things that I don't know is really like, do you guys feel like you want to talk about health insurance, or are we really just talking about medication assistance? I haven't talked to anybody there in quite a few weeks, so I'm not sure where you all want to start.
I think we start with the medicine, right?
Oh, I didn't hear. I heard a bunch of sounds, but not words. Can you say that again?
MedRefer, right, Molly?
Yeah, if we could dive into like med data.
Yeah.
Because like I don't even know how to get to the site, let alone log in anymore.
Okay, good. Okay, so I think we had entered you. I'm assuming that means that no one else has gotten in since I got in. Okay.
I helped Matt Finley get in the other day to run reports, so okay. I at least remembered that.
Okay.
He logged in as me, so I'll have to, or Molly or I will have to add everyone else into it.
Okay.
Through that administrator, but I do know how to do that.
Okay, good. So we know. Let's see who's already in there. Okay, yeah, so I guess there's just Chris and Christy that can log in. Christy, have you logged in yet?
We did it on like the first week that I was there, but really I didn't know how to navigate anything in there.
Okay, and what I don't know, did you guys already receive any of the instruction forms?
I don't think so. That doesn't sound familiar.
Okay.
I didn't.
Okay. Because it does exist. It should be saved in what I think would have been the N drive, and in MedRefer, there's step-by-step instructions on what you have to do when you want to record something, like how to create a program and all that good jazz.
Okay. Yeah, I don't have access to that. I think that's for some reason I don't get the N drive. So.
Okay, in Stark County, they call the N drive, that's your personal drive, and the H drive is your whatever. So whatever the shared drive was, it should be in there under MedRefer.
Okay, I think I'll have to get that from either Molly or Chris then.
Okay, just so you know where it lives.
Okay, so
So
Adrian, so it's in the MedRefer folder, and then under instructions, or do you have any recollection as to what the folder was that it was in?
Kind of. So if it would have been in, oh gosh, is that the F drive? Which one's the safe drive?
I know where it is.
You do.
I know where it is.
You know where
okay.
it is, Chris? Okay, great.
Yep.
So I guess we'll just start at the beginning and kind of go from there. And sorry, I just really didn't kind of know where everybody was at with it. So should somebody call in, they're looking for help with medication, and we're going to call him Bill Smith. We want to look up to see if Bill exists or not. So you can use this bar up here, this blank space, to look for somebody. And of course, you can do it a couple of different ways. You can go to your patients. You can go over here, and you can just type their name in here as well, whichever way you feel most comfortable. But you could scroll in, scroll down to see the names, of course. And gosh, there is no Bill or William Smith. So if you want to go ahead and add somebody, let's see, we can go to patients, whoopsie. So assuming we know that Bill's looking for help with medication and he doesn't have health insurance coverage, this is where, in order to create a patient ID, we're coding them based on what their insurance type is, because we need to know what the insurance type is to give that to the funder of the program. And there is a function in here where you can list what kind of insurance they have, but you can't export the data. So you have to kind of bastardize it and use the patient ID. So here, I have used UN for uninsured. That sheet that's saved in there, it tells you how to create all of those. But so you use UN for uninsured, you use CARE for Medicare, AID for Medicaid, nice and simple, right? And then you use a 4-digit number. I've only picked 4 digits because that gives you sufficient choice to have a unique number. It doesn't have to be with their phone number or their social or anything. You can use any 4-digit numbers. So if we're going to enter his name, address, things that you're going to need. In that sheet, there is a list that tells you exactly what you need to have for reporting purposes. When it comes up to selecting the physician, someday we may want to be able to say that, oh, we helped XYZ number of patients who were from Metro Health or university hospitals, just to be able to report back to them to say, we're working with this many of your patients, wouldn't you like to give us some money, right? So some of them are in here, some of them are not. I don't get more, at least I hadn't gotten any more specific than, say, the name of the facility, just so that we could identify it for a potential funder. And then, of course, the birth date. If you don't have the birth date, using January 1 and then the year, that certainly makes good sense. For reporting, you'll also need to have gender, also race. Marital status is kind of helpful only in that when you ask later on for somebody's income information, then you'll know whether or not you're really looking for a 2 or 1 person household. Citizenship is not always relevant with drug company programs, but occasionally is, so that's helpful. Now from here, you actually have to hit save before you can go into the other tabs. That will allow all the rest of those to come up. And so when you first search for Bill, again, the first page that comes up, you'll need to go over to select to open it back up. And this is the first page that comes up. So from here, you would add other information.
Adrian,
Manufacturer IDs. Go ahead.
sorry, don't want to interrupt, but I just emailed those guys the instruction forms.
Oh, good. I think you'll see it's pretty easy. It's pretty intuitive. There's a couple things that are just wacky, but you can work around those pretty easily. The manufacturer IDs, nobody really uses anymore. Eligibility is fairly useless, so you can ignore that for the most part. Notes are important, of course, so that when you want to go back and call someone to say, hey, did you fill out this form? If they've got a detailed story, you can put anything in there. Normally, I would just essentially copy and paste whatever notes I put into ReferNet here, so I can kind of match them up. And there's a fun little process to this, so you can type in whatever it is that you're going to type. If you click alert and then hit insert, then it will show up on that first information page every time in red. So
when might you need to do that?
well, almost always, honestly, I put that alert on because to me it's helpful. I'll show you here. Because that way, whatever I typed in stands out when I open it up. And I like helpful hints. So whatever you type here, if you don't click it, it won't alert, it won't fill in here for you. So you can edit notes by using that field. You can delete notes, of course. You can add as many as you like. So you can use this kind of like for progress reports if you choose. Documents, we used to upload things and we don't do that anymore. Diagnoses, in that list of instructions, it lists out what the diagnoses are. There's probably about 15 different things. They're all sort of generic categories so that you can report back to Sabrina, hey, this is kind of what the scoop is, that they relate to mental health, blood pressure, diabetes, heart disease. They're all kind of broad categories, so you can have a look at those. Insurance types, obviously really important to check for your notes for later on. This is that nutty field that you can't export. So if you want to go back and look at somebody's file and say, hey, do they have insurance or what's going on here? This is one place that you could store that information. We said that he is uninsured, hence the un, so we're not going to check anything there. Income, the employer we leave out, taxes, all that good jazz we leave out. What is important is to put in their income amount. So say he works part-time and he makes about $800 a month, and he is married and his wife makes $500 a month. I've always put the other down here to put their income, and it was just really helpful in the days of the modified adjusted gross income. You could kind of see if other income in the household, you could put it here, but then not include it in the modified adjusted gross income, so you know where to count it when you look at someone's qualification for Medicaid. Does that make sense? Sure. Okay. Cool.
No, I just one question. Could we put it in like the spousal income? Would that make more sense? Or
see, I think in my head, spousal income means not child support, alimony.
Oh, income from like a former spouse. That's how you? Okay.
Yeah.
Thank
So
you
can do it whichever way. The world is now your oyster. So essentially, that is kind of it. Then so you've got someone's profile in there, and if you'd already talked to him, you've established that his income looks like he's Medicaid eligible or whatever it is. If you want to create an application for him, say he looks like he's going to be Medicaid eligible, but you know Medicaid doesn't pay for a specific medication like Harvoni, like something for hepatitis. You can go here to create an application for him. And you just enter the drug name. And it's kind of cool because you can just, if you're not sure how to spell it, you can use something like GoodRx to help you to figure out how to spell it because the patient doesn't know, or you can just type in an H and then it'll give you an entire list. So again, you just have to type in the letter. It will bring up the application. and you have to hit add. And you can add from here as many drugs as you need to. There are some that will be like the Health Well Foundation here, which is like the copay foundation. This is a reimbursement center. If you were to open this up, you'd see that it's reimbursement for like hospitals, because sometimes MedData is used by hospitals, but you want patient assistance. So that's the one that you would add. To create the application itself, you're going to go over to details, and this is kind of a fun one. So you kind of have to get some context. If someone, if you were to go to like GoodRx, say, okay, well, this person's going to need Harvoni, but they don't know the dosage that they're using. They know they have to take it once a day. Well, you have to think about whether or not someone would take Harvoni for 6 months, for a year, or, you know, how long is the time period? Because normally you don't take Harvoni or certain medications ongoing. It may just be for a few months. So if you were to use GoodRx, it kind of gives you an estimated how many of the medication are they going to be taking. So it looks like someone would be taking 28. If the patient doesn't know, you can use this as a guesstimate. And if I can see underneath here to get back to where I was. There we are. So I think you normally would take Harvoni for something like 4 months. So whatever the quantity is. Here they just allow you to choose tabs. Your day supply is also 120. Advair Discus, these come in 60s. 60 is the size of the inhaler, not necessarily the doses. You'll see that there are things that are peculiar with insulin, and there's some really specific instructions on there. It can be really useful, again, if you go back to Advair and you say, okay, this guy needs four inhalers, right? Okay, it's 120-day supply. Then you can go back to something like GoodRx and go, okay, well, if somebody were to take Advair, see, how much should Advair normally cost somebody? These are discount prices. Okay, so if we were just to guesstimate, they're going to cost $367 at a discount price. So when you run this, you should be able to see it's going to cost them at least $1,500. My computer is super slow. Autofill, Cleveland Clinic. You just kind of eyeball it and go, yep, all that stuff filled in, and create an application. And these forms all come up, and you can hit print selected documents, and it will populate all of those forms. What we haven't done, though, is to enter the diagnoses, and we need to do that. So we go back up into, so you can find the client again. Whoopsie. There we go. We go back to the diagnoses, and now that we know he has hepatitis, one of the categories is infection. And if it's Advair Discus, then he has a breathing disorder. Sometimes it's useful if you say this fella has asthma, because some of the national foundations will assist with specific diagnoses. So if it's a breathing disorder, it may be useful for you to say, oh, it's a breathing disorder and specifically asthma or COPD or whatever it is. Just more information. Yeah.
Sorry, quick question. Oh gosh, what did you say? It was something, I had a question about diagnoses, like where oh, the categories. Where did you find the categories to, so like for the diagnoses?
Well, the patients, you can, because medications are used for lots of different things, you may find that someone is using, you know, a medication like Advair for a breathing disorder, but it would specifically break it down to asthma or lots of different things, lots of different varieties of breathing disorders. So you just have to ask them, so what are you using this medication to treat?
Okay.
And
But when you picked infection, is there
Uh-huh.
like a list?
there is. Yep,
Okay.
there is. It should be in that sheet. And do you mean a list for how do you know what the drug is used, or what diagnosis you're supposed to use, or both?
Diagnosis, like the categories of, is there a certain amount of categories with diagnoses?
There's the diagnoses that I used are all in that training sheet.
Okay.
And there's 12 or 15 of those things. And you can pretty much put them into one of those things. But also in that summary, it kind of notes, you know, certain drugs like gabapentin can be used for a number of different things. So, you know, it can be used for diabetic neuropathy. Well, they're treating pain, not diabetes. So you're really looking at what is the medication actually using and choosing the category from there.
I see. So even though they have diabetes, you're choosing the option that, like, the symptom that the medication is going to cure or relieve.
Yep, you got it.
Not the underlying diagnosis.
Right.
Okay.
Yep.
Now, but if it was for pain, for diabetes neuropathy, diabetic neuropathy, would you have more of a shot of getting them a discount if you choose diabetes than just pain, or no?
Nope, because all their drugs have to be, well, the drug manufacturers are going to be, may only assist people for appropriate label use. So whatever it's FDA approved for, if it's going to be an off-label use, the drug company won't help you with it. Like Lyrica at some point was used allegedly for mental illness. Well, you know, or not for mental illness. It was Lyrica was being used for like diabetic nerve pain and mental illness and this and that, and a whole bunch of stuff.
Fibromyalgia.
Yeah. So, I mean, even with something like fibromyalgia, well, what is it that it's treating? It's treating the symptom that's pain. So you would want to include that with pain or inflammation.
Okay.
Because it's going to be based on the diagnosis that the doctor gives, and the doctor's not going to say, "Oh, I'm diagnosing you with you know." I'm not giving a very good very good answer to that question, but
like, could you put both? Could you put diabetes and pain, or no?
I think it's a general rule. You're going to find that if someone's using, for example, a medication for diabetic nerve pain, they're probably taking a diabetes medication. So it's going to be in there anyway. So we're still going to be identifying this person who's diabetic with a different medication.
Okay.
But you're going to be able to get help like through a national foundation for a patient who is diabetic if that medication doesn't actually treat the diabetes. Like, like in ReferNet, there will be like copay foundations that will help people with cancer. The only medication they're paying is actually treating the cancer itself. So something else that's a symptom of or is just a comorbidity, they're not going to cover.
So, like the diabetes foundation would would give you insulin, but not like Lyrica. Or
yeah, exactly.
Okay.
Yep.
I got it.
And if the patient responds to you that, you know, hey, what are you using that medication to treat? And they say, oh gosh, it's Vicodin and I'm using it for anxiety. Well, probably not. So you can use something like GoodRx to look up what the medication is normally used to treat. Because happily it tells you those things as well. So pain medications, blah, 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 right?
Okay, okay.
So you don't have to know everything. You can just look the little buggers up. And you can ask your patient, they may or may not know.
Right, which, yeah, I'm counting on that, so, okay.
Because you've worked here for a while. So for this person, when we go back to Bill, if we want to find the applications that we created for him, we're going to go back over here to history, because that's going to show us everything that we got up to. So to add that piece with the diagnosis, you have to select the drug, and then wait an inordinate amount of time. And when you go over here to diagnosis, you can select it. And if you haven't entered it, you'll know because nothing will be in there, right? So for this guy, it was asthma. You can put a little note in here if you choose to say, you know, whatever, we mailed the application or emailed it or whatever it is that you note that you would find helpful. If you save it, then you can make additional changes to it. If you just hit save and close, it just brings up the next one. And we do the same thing here with the Harvoni. We just need to make sure that we put in that diagnosis part so when we run a report, it makes good sense. So this is the infection. So when we look at the cost here of the AWP, in order to figure out, you know, is the average wholesale price, is $162,000 a reasonable price for 120 of these? And I think we saw over, when we looked it up on GoodRx, that the average monthly cost was around $28,000. So a retail price or wholesale price, $162,000 is not insane. Does that make sense?
Yep.
That's a lot of money.
It's a lot of money. So the wackadoodle one's just a little bit fun here would be the Advair. When we looked up at the Advair price, because the quantities can be a little weird when it comes to inhalers or anything that's a liquid. So Advair was the one, if, you know, we're guesstimating a discount price would be $367, and if we're looking for 4 inhalers, oh, looks like the cost would be someplace around $1,500. And the prices, of course, do vary by strength. So I looked up, the price here was for a 250 milligram or microgram. And actually, I would need to change that and say, oh no, this is a 250 microgram, so that may increase the price a little bit. So assuming you've printed out these applications, I can show you those. So this comes up under the details when you open that record. Dispensing, we don't use this. Under documents, you can print selected applications. These things up here are just kind of, this is what you would use if you had loaded in as a doctor's office, these materials, but we don't do that. So you just hit open, and then it just will pre-populate the form for you, and it puts in, of course, what you put in, so if you goofed, it'll goof, and then you'll want to go through and correct everything to make sure it's all square. So we know it's Bill Smith, and that's his address. We don't get social security numbers from anybody because the liability is just nuts. Important things, we want to make sure that everything is filled out on the form is the best of our ability. In that same MedRefer file, there's a little chart that you can kind of fill in. It's a fillable chart that you can kind of do an intake. I think it's called an intake form. And it gives you all the information that you might need under the sun to fill in one of these applications. If you were to start out working with people using that form to make sure that you're getting all the pertinent stuff that's going to be on these applications, it might be helpful just to get some practice in. These things, when it comes to diagnosis or any of those things, are not things I filled out in the past. Generally, the docs are going to need to do that. I can, like on this application, it says what's the medication that's requested. I would put that in because it's not a prescription. So any of the prescription portions I would leave out. I always have left out the income because lots of people don't know what their income is. They guesstimate and then it doesn't match. And I don't know why it won't let me edit this. This is interesting. Okay, I don't know, but it won't let me edit this at the moment. But normally you can just open it and edit the application so you can check all of the boxes for them because we're really good people and that's what we do. And sometimes if you don't address it, they won't either.
Do you have to edit it like not on the application, like where you entered the info into, or did you normally used to be able to edit the application?
Well, I think I haven't had this experience. I was in here yesterday on my work computer to make sure I could still Friday, on my work computer to make sure I could do it and I could edit things just fine. So I don't know if I'm having, if this is just I need to update something. But you should be able to update and change all these things because they're not all things that you're going to be able to edit on that page. Like these things, it won't select these questions for you because not every single question is loaded into that intake form. So
now, if you edit something that it exported for you, is it going to edit it everywhere in MedData?
It won't.
So it might make sense to edit it in like the data fields instead of in the application, right? So,
yeah, right. So if I got Bill's address wrong, absolutely go back and change that in MedData. But if you want to answer these questions, MedData is not going to save this stuff. So you still have to change it.
Okay.
Or if you want to leave out the income information, you can edit and take out the income information.
I see.
But you want to retain that so that when you go back to look at the person's file, you know what their income was. You don't have to start all over again.
Right. Okay.
So we would just go through each form, and they're all different. Unfortunately, they are. You just kind of have to, there aren't a million of them, so don't feel nervous thinking that there's going to be a bazillion of these things. There's 5 to 7 that you use 100 times. And so you'll get to know them pretty well. They do change on a pretty regular basis. So, before you tell someone, I think you're eligible, I always like to look them up in Needy Meds first and say, okay, this is the criteria before I go to the trouble of printing it out. So I can go back over there. Have you guys looked at all at Needy Meds?
Yep.
Nope.
Well, I have.
I have.
Okay.
I have not.
Okay. So Needy Meds is pretty cool. Christy, do you still have a list of the links? The links.
Yep, I sure do.
Super. Would you send that to the Planet if you haven't already? I think they're in those instructions that I left as well, but I can't remember. Would be pretty cool if I actually had a copy of those instructions to share with you guys, but
I almost emailed you, but I forgot your account's disabled. So I did try to put, email the instructions to you as well. Do you want me to email them to your personal?
Yeah, absolutely.
And what's that?
It's a price. Well, just send it to, it's adrian.price@uwstark.org.
I'm sorry, Adrian Price at uwstark.org?
Yep, it's adrian.price
Okay.
at uwstark.
And I just checked that email that Chris just sent, and it does have your those links in like a little blocked field on the front page. So everybody should have those in the email that went out.
Excellent. Groovy. Okay, so Needy Meds is just a website that's been around for 100 years. It's kind of the grandfather of drug company assistance programs. So even though it's pretty ugly and there's a lot of stuff going on here, it's always got really accurate information. So if you were talking to Bill and you found out he was uninsured and you sounded like his income was something around 150% of federal poverty, okay, we know that he probably can't get Medicaid coverage. All right, well, he needs help with Advair. Well, let's see what the rules are related to Advair. We just type in the drug in that little box. Alternatively, you can use these alphabetical links if you like. But if you just type in the name of the drug, it'll pop up. There'll be a couple of different ones. Sometimes, like here, they are exactly the same thing. Other times not. You'll see one might be a liquid or one's an ointment, one's a cream. Just, find out which one it is for sure. The little pills that gets you to the link for the drug company programs, among other things. So the first thing is that GSK Access program, the application that we printed out, and it gives you kind of all of the different rules. It tells you the phone number, gives you a link to the application itself, but it also will tell you, do they help patients who are uninsured? Contact the program for details. You'll kind of get a theme here that there are a few drug companies that will help patients who have insurance coverage, but the circumstances are pretty specific. So if Bill had insurance, you may want to call them real quick and say, so this is the scenario. Is this someone who should apply? And they won't be able to generally tell you, no, he shouldn't apply. What they may say is that he may be eligible under appeal, or they may be willing to tell you that, no, he shouldn't even apply. So they'll at least couch it and they'll give you a maybe or a no, if that makes sense. So folks that are Part D eligible, so those who have Medicare Part D, a lot of times those folks get to the coverage gap or the donut hole pretty early in the year, so they may need some help. Bill is not in that situation, so we can ignore that. At or below 250% of federal poverty, and really most of the drug company programs are 300% of federal poverty, well, between 100 and 300% of federal poverty. There's a couple out there that are just 100% and below, so use caution there. Of course, diagnosis criteria, well, it has to be a drug that's approved, FDA approved for that use. Only a few of them require that you are a citizen. Most, you just have to be a resident, as in, I live here physically. And there's other kinds of instructions. It gives you an idea of when the decision is made, how quickly you'll receive the medication, all that kind of good information there. But there's more, like the HealthWell Copay Foundation. That is someone who has health insurance. Copay foundations, you don't have a copay, you actually have to pay for the whole thing. So the Copay Foundation would not be relevant for Bill, but they're all listed here. Patient Access Network Foundation, another copay foundation. The Reimbursement Center, this is really just for hospitals and things to get reimbursed for something that they dispensed. That kind of gives you an idea of kind of the lay of the land. If you want to double check to see if someone's eligible, I would normally, so if someone says that they're looking for help with a medication like Ventolin. Okay, well, so do you have any insurance? No, I don't have insurance, and this thing's going to cost me $1 million. Okay, you can look it up in GoodRx and say, okay, with a discount card, it's around $56. They may say to you, oh, well, I was getting charged $90. I can do $50, and you can just text them the free discount card. Done. Or you can say, well, I don't have that $50-some. Is there another drug company program that would work? Well, the same company that makes Advair makes this. So it's the same application that you can send them. So Ventolin, it's thinking really hard. Shows you where the Ventolin is. This is just a drug information icon, so not real helpful. And again, it gets back to the drug company program, the copay foundations, Patient Access Network, GSK Access. There are other things that you can find on Needy Meds that are particularly helpful. Like, let's see here, based on diagnosis-based assistance. So if we know that Bill is using his medication for asthma, if you go under diagnosis there, and you look under asthma, they'll then tell you nationally what are the organizations that would maybe help with a copay if Bill had health insurance coverage. Places like Good Days, Patient Access Network, and of course then there's some that it becomes specific to the different states. You'll see when you go to look through that instruction page, you'll see that Ventolin is a curious drug in that the generic may be available elsewhere. Albuterol is the generic drug, used to be available, comes in solutions now, not in the inhaler, and people don't use those things interchangeably. But if you were to look for, I keep losing this, under you, go that way, thank you. If you look under albuterol, you can see what other options there are for albuterol, allegedly. See how many albuterols there are? So you can see that Ventolin is albuterol, Proventil is albuterol, as is ProAir. So if you were to look at one of those, that gives you some other options. And albuterol inhalers are just kind of unique in that way. So if I want to see, well, what is ProAir? And honestly, there aren't a million of these drugs that are like this. ProAir is one of those kind of unique drugs. But it's essentially the same drug, but there are different ways to get it. So ProAir is something around the same price, but there are other drug company programs that may be useful. There are other foundations that will help with it. And I'll show you in a second. So Teva is the company that makes it. They will not assist patients with Medicare. That's the most important bit. If you don't have health insurance, they'll be glad to help you. Also the HealthWell Foundation, Patient Access Network. There's also a different program. Has anybody made any recent referrals to the drug repository?
Not me.
Okay. So RX Outreach is a discount mail order pharmacy. It is listed in the database. But you can use this site to look for discounted medications. So if you can see here, with RX Outreach, you can buy the ProAir inhaler, which is the same thing as a Ventolin inhaler, for $35. Or if you were to use that Buter drug that's listed in Refer, the cost is, I believe it's $20 per inhaler. And then there's like an $8 mailing fee. Have you guys all heard of, or at least read about the drug repository?
I've sent a couple people there
Okay.
within the last month or so.
Groovy. So of course they do. It's up in Sandusky, and it's a 30-day supply of brand name drugs for $20. Generics are $15. They have lots of medications that can be really expensive, but that's just the price. They tend to have medications for chronic illnesses, but they do sometimes have things like antibiotics. They only do dry goods. They don't do any liquids or, like insulins or creams, lotions, all that kind of good jazz. So roundabout. Do you guys feel pretty comfortable with determining who's eligible for something like Medicaid? And I'm asking about Medicaid just because in order for you to kind of get a handle on screening somebody for eligibility for these programs, you kind of have to figure out if they qualify first for something else.
I wouldn't say I'm comfortable with it, but I've been learning a lot about it in the last couple weeks. So
Good. Okay.
Is there any kind of tool to calculate that monthly gross income, or is there something that can be obtained from JFS that has, because sometimes the amounts do change, that has the current amount, and breaking it down by a household of one, household of two, et cetera, et cetera?
I think in the the last time I looked at Refer, there is that little, the little calculator in there that you can check, where you can calculate what that is in Refer. Is that link still alive?
Yep, still there.
Yep. Yeah.
It
so
is.
You
I haven't used it in a while, so I quite frankly am sorry to say, embarrassed to say that I don't know if it is just for food stamps or for Medicaid.
It calculates the federal poverty level. So it's going to tell you that that person's at 130% or whatever percentage it is specifically. And then you have to use the information and Refer to identify if that's, the criteria. So for food stamps, is it the 130% or is it Medicaid? Which kind of Medicaid and what's the income guidelines associated with that particular category of Medicaid? There are some sorry
to interrupt. So I can show you that tomorrow. The most important thing is you'll just know what percent it is that Medicaid, what they need the income to be, and then you'll just know, and it changes from year to year. So I can show you that next time you're in.
Okay.
Some
thanks.
programs are 100, some are 150, 175, 200. So I'm not sure off the top of my head about Medicaid, but I can definitely show you how to find that out tomorrow or whenever you're in next.
How far back do they need to calculate that? Like if somebody had some good income before but lost their job, are they averaging it for so many months back, or is it just your current situation?
They used to average it, but they don't do that anymore. Today, it's based on what your income is right now. So if you lose your job yesterday and you can get a notice from your doctor, from your employer that says, I've been terminated, then you can take that to Job and Family Services and apply immediately.
Okay, thank you.
And it's only Medicaid is really about what your income is right now. When it comes to the marketplace, that really they're going to look at your annual income, which is goofy. Are you guys getting calls about the marketplace at all yet?
I haven't had any.
Yeah.
Nothing? Okay. Yeah, it looks like it's been pretty quiet all around.
Yeah, the only calls I had about it were actually a while ago, but not anything recently, which I would expect that there would be something happening now, but not much.
I understand in Cuyahoga County, I think they were talking about, the Outreach and Enrollment Council was talking about doing some really limited outreach with the colleges, but otherwise nothing. In Stark County, there's a funder who's thrown some money in to do some outreach, as in Summit County as well. So there'll be a little that'll probably touch in Cuyahoga County. Okay, so Bill. So say Bill calls in and he's like, hey, Adrian, I sent you this, you were supposed to send me this application and I never got it. In order to find Bill, you can pull Bill up by his name, of course, or you can go back into this tracking system. Like Bill called, you can go back into edit a record and tracking, and it just pulls up everybody, what you've done in the last who knows when. So we can see this is what we did for Bill, and all the way back to these other folks. So these things here are a little bit interesting. In those instructions, you'll see, these are the drug company programs, right? And then these are the discounts. Back when I started there, we weren't recording what our discounts were, but it really can make an enormous difference in somebody's world. So we want to record that and report it to the funder. For example, we can see that Lorna, we saved her money by sending her to a mail order pharmacy. And under the drug name, we've kind of bastardized MedData. So we use these made up little categories so that we could export the information. So you'll notice that all the drug company programs start with a capital letter. So in the instructions, you'll see every time that you put in a discount program, whether it's for, we sent someone to Drug Mart and we saved them money. We sent them to a copay foundation, we saved them money, or a mail order pharmacy, or sent them a discount card. They all start with lowercase letters. That way you can eventually get to automating those reports in Tableau. That's the way that Mike Mina set it up for us. So anytime that you're going to enter a discount, you're going to use a lowercase letter.
Okay, and then if maybe Molly and I can talk to you on a separate webinar about reporting, because yes, because Matt was like, what? I have to, you know, when he was trying to do the reports for the second quarter, he was like, oh, like he had to filter out by caps and not. So I don't want to hang anybody up, but maybe Molly and I could schedule something just with you to talk about recording in the future. I just wanted to put that out there. Write that
Absolutely. The easiest thing is all of the drugs, the drug company assistance programs are all caps. So it's really easy to see visually, even if you have to manually screen it or sort it rather.
Okay, I understand now why. I just, okay, but yeah, we should set another, just like a reporting thing up.
Okay, we'll go out for drinks.
Yeah.
Woo!
We'll have
Okay,
some
so
hormone.
the discount stuff. So want to go through one of those guys because it'll be fun? Why not? Okay. So it looks like we talked with Jackie, who needed a blood pressure medication, and we got her a discount. The discount was 72 bucks. So normally that means it would be a discount program. So say Jackie called in and she was looking for help with Bistolic. So Bistolic is something like, oh gosh, she was saying it was hemoglobin. Oh, be quiet. So assuming Jackie got a price from Walgreens or something, and it was like $150, $200 for medication, we can assume that, okay, so if the medication, the discount price that we could offer her at Walmart was $127, then we can assume that she was telling us the drug price, they're charging me $200 a month at Walgreens. Okay, well, let me check the price of this drug and see what we could do for you. So if we were able to look up the medication and check her dosage, making sure, you know, it's the right strength, right quantity, all that good jazz, the price, I can send you a discount card that'll make it $127. Okay, super. It's going to save me 72 bucks. Great. So that's when you would go back and add this. We'll go from the start. So if we can find Jackie in here. Miss Jackie's in there. Assuming we have all of her information entered. Yep. And diagnosis, we have heart blood pressure. So you can create an application for like the discount, or excuse me, you can create an entry for a discount by going to Add Provided Med. And it works similarly, just a little different. So we're going to put in Miss Jackie. Leaving out the doctor, you can select her, oh gosh, it's for heart blood pressure. And for this, we just sent her a discount card. All of those codes are listed in the instruction sheets. And all we're doing is saying, yes, we were able to save her $72. And then we save and close. If we hit save and new, it keeps Jackie in there. And we can say, oh yes, we actually also sent her to a mail order pharmacy to save her $27 on her inhaler, whatever it was. So you can see that Jackie just pops up here on the list. So does anybody want to do like a walkthrough or pick some drugs or people or scenario and we can just do one live?
Sure.
Sure. Okay. So what's going on? Who wants to be my victim? Or I can just make somebody up. I thought we'd be interactive for a minute, but whatever works.
I can be your victim.
Yay, Marissa wants to play ball. Cool. Hi, this is Adrian. How can I help you?
Well, I went to Walgreens where I usually get my prescriptions, and they told me that the prescription for the pericarditis was going to be like $500. And I was like, no way, there's no way I can do that. Even though I've got insurance, the insurance won't cover it.
Wow. Okay. Well, yeah, that sounds like it's an awful lot for anybody. So do you happen to know what medication it is?
Well, yeah, I think that we're going to start off with Inderal first.
Inderal?
INDE. It's an anti-inflammatory.
It is. Okay. Let's see. So there's Inderal XL and LA. Do you see anything on your prescription that tells you which one that is?
I think it's the XL.
Okay, here. So let's pull this up here.
At least that's what it looks like on the prescription, but it might as well be in hieroglyphics.
Okay, yeah, that happens sometimes. Now, is Inderal the only medication that's going on that you're struggling with here, or are there other things?
That's the only one that I'm struggling with right now.
Okay. Now, has your co-payment changed recently, or like is this a new drug for you, or did it change in co-pay amount?
Both things. It's a new prescription, and I had to change insurance providers during open enrollment to be able to continue to go to the doctors that I go to.
Okay. So do you feel pretty confident that the drug was actually covered, or like have you checked with your insurance company to make sure that it's covered yet?
I have, and they started talking about some mumbo jumbo, formulary, proprietary, all that stuff, and I don't understand any of that stuff.
Okay. All right. Well, there's a couple things we can do to help to figure this out. It may be that you haven't met your deductible for the year. It may be that do you feel comfortable with what a deductible is?
Yes.
Okay. So it may be that that deductible, so you can check with your insurance company to make sure that that's actually not in your way. It also could be some insurance companies have deductibles for specific drugs. So you may have, that might get in your way too. But let's see what other options we have here. So bear with me just a quick second. Now, on that particular drug, do you know how often you're supposed to use it?
Twice a day.
Twice a day, okay. And how many milligrams is it?
I believe 30.
30, okay. Let's see. So if we've got, well, looks like we have a patient co-payment foundation that may be able to help. Now, this particular company has income guidelines. So, can you give me a rough idea what your income is each month?
About $500 a month.
About $500 a month. Okay. So at $500 a month, you likely would qualify for something like Medicaid coverage, which means the national foundations probably wouldn't help. So when you signed up for the health insurance marketplace, did you feel comfortable that they screened you for Medicaid, or did your income change since you did that?
Well, the income's changed. When I had first applied, it was well over 3 times that amount.
Okay.
But then with, different job scenarios and what have you, now it's been reduced.
Okay. Okay. So it sounds like now might be a good time to reapply for Medicaid with that change in your income. But kind of in the meantime, let's see, how soon are you going to be out of the medication?
Well, I've been out of medication now for 3 days.
Okay. Wow. So is your doctor aware of what's going on for you?
Yeah, but he's on vacation.
He's on vacation. Okay. Does your doctor happen to be at Metro Health or at one of the local community clinics?
Through UH.
Through UH. Okay. Okay. And I'm asking because sometimes certain hospitals or community clinics will offer a special discount program. So unfortunately, the one that you're working with right now isn't able to help in that way. So let's see what we can find out here. So did you say, was this the 120 milligram?
Oh, well, I thought it was 30 milligram, but now that you mentioned, I may have looked at it wrong, and I think it's 80 milligram.
80. Okay, 80 is a little bit better. Okay, so this medication looks like it's still pretty expensive here, and I think you said you were taking it twice a day, so it's really terribly expensive stuff. What you probably would want to do first is you can contact the Patient Access Network Foundation. Because you have that private insurance, you may be able to get help through them. What they'll do is they'll ask you some basic questions to see if you qualify, and then they'll be able to enroll you over the phone and then give you the billing codes to help with that copay. So that's one place to start. You definitely want to apply for Medicaid. Medicaid actually has a new 800 number where you can apply over the phone, and almost half the people that apply over the phone actually find out that they're eligible immediately while they're on the phone. So
wow.
Yeah, it's pretty groovy, I'd say.
Yeah.
But so let's see. I'd like to offer you a backup plan.
Okay.
So the backup plan, certainly call the Patient Access Network Foundation. If they can enroll you in the program in real time, you'll be able to get help right away. If for some reason you don't qualify, I would contact the drug repository and ask if they have it available, because if they do, there it would cost you $20 for a 30-day supply.
Oh, wow. That's
I know,
awesome.
I'm amazing, right?
Yeah, I'm telling you.
Look at that, look at that, look at that. So with Maritza here, if she is taking this medication, $794 times 2, and she's able to get that through the mail order pharmacy for $28, including postage, that would save her a good $1,500. So if we want to log that we were able to save Miss Maritza some cash, we would enter her as a client, and we're going to add a pretend client. So we're going to actually change Maritza's name to Jackie, and we're going to just add this into tracking, the tracking system here where it was. And we're going to say we were able to help with the repository, and we were able to help to save her some $1,560. And that is that.
Awesome.
That's kind of it in a nutshell. So Maritza, do you feel like you've got a good place to start?
Yes, I do. Thank you so much. You are marvelous.
Okay, so that's my story. That's kind of about where I would go with that. Anybody else want to play? Did the way that rolled out make sense to anybody, or no sense, or all sense?
No, I thought it was really good to like put all of the different steps together in one big scenario. That really helped me see how it all goes together.
Okay, cool. Katie, are you still alive?
I am. Sorry, I didn't want to interrupt. Yes, no, I like that. That was good. So do you kind of just go back and forth in the beginning between GoodRx and the Needy, was that Needy Med?
Needy Med?
to try to get a better idea of, what the price is, or, what your option is? Is that your no set starting point, either one? Is that where you start off with usually?
Well, yeah, normally, and it's hard because I've only done this for 15 years. So in my skull, a lot of that stuff already lives, which is good and bad because the drugs change and the programs change. So normally I would just start out trying to guesstimate by looking at someone's drug going, okay, because someone may say, oh gosh, well, I'm looking for help with amlodipine, and well, the price that I got from CVS was $35. And if I can type it in and go, okay, but you said you're using the 2.5, right? Okay, and you take it once a day? Okay, so if that medication was something like $8 or $10, is that something you could afford to do? That would, if they say, oh, $8, I can do that, I can send them a discount card, and if they feel like it's doable, then we're done. And if it's not doable, then we can explore other options. Okay. So I usually would start with this, and if they can do it, great. If they can't do it, I really do like to look for backup plans. And long term, really just, what am I going to do to get the medication right away? Of course, we know presumptive enrollment in Medicaid still exists, so you can still use Metro Health, but usually one of the health centers to get enrolled in Medicaid immediately if it looks like somebody who's under 138% of federal poverty level. They may be able to do some walk-ins at those FQHCs in town and get Medicaid or help with the medication right away from their contracted pharmacies. Anybody else have a scenario or a question?
I do have a question.
Yeah.
Oh, I'm sorry. Did somebody else have a question? Did I just interrupt?
Nah, you're good.
Okay. Well, the question I had is, what is the role, if any, of centers for families with children in terms of providing prescriptions? Is it someplace that 211 refers to? Would it be appropriate? Does it work kind of like, Care Alliance and such, where you have to get seen and have a prescription rewritten type of thing? Or is that not a resource? Or are they limited with the medications that they might help with?
Well, my understanding, though, and Molly or Chris chime in here, my understanding of Centers for Families and Children is that they do have one of those central pharmacies, but it's only for their patients. Mm-hmm. So you have to be a patient of theirs in order to get that assistance. And it's not always free; it's sliding scale. So if you get sliding scale for a drug that's $150, it may not be that useful for you.
Okay, well, that makes sense. Now, what about like with Care Alliance? For example, I don't know if they still have a relationship with some of the area pharmacies. Mm-hmm. So if you get something rewritten in, let's say, the standard cost, like let's say the Inderal, $700 type of thing, and you're willing to go because you still have a couple, 2-3 days worth of medication, so you're willing to go, you can get an appointment, you get seen, here's my prescription, they rewrite it, they send you to the pharmacy at Dave's, down on Payne. Is that something that's also doable? Is that still happening?
Well, but the pharmacy down at Dave's, they do have a relationship, but I believe it's the 340B pharmacies. And the 340B is that federal discount program where, the area FQHCs and Metro Health and some others that I don't know that function very well have access to federal discount pricing, so it can make meds really, really cheap. But I think the community clinics normally charge based on sliding scale, so there's still a fee for it, and you have to go to Dave's to pick it up. Dave's, or sometimes Walgreens or CVS, is the contracted 340B pharmacy. you still have to pay something for it. And you're not going to know how much that is until you go to the pharmacy and they're going to bill it under 340B.
Okay, so then you would have to pay. Oh, okay. I'm sorry. Go ahead.
No, go ahead.
Well, no, I was just going to say, you know, there's still going to be then that charge. It's not going to be like, for lack of a better term, like a voucher where you could get a voucher, say, okay, hey, here's this, and then the pharmacy charges the fund for that reimbursement rather than passing it on.
Well, that's the charm of 340B, is that it's up to the institution how much of the savings they pass on. For instance, there's a 340B pharmacy that is at university hospitals, and there's one at Metro Health. If I'm a patient at Metro Health and I get my Levemir insulin from Metro Health's 340B pharmacy, and only certain ones have it, they're all listed in the database as to whether or not they're offered the discounts. If I get my Levemir at like the main Metro Health prescribed by a doctor at that location, then the Levemir is about $9. Retail price on Levemir is more than $300. If I go to University Hospital and I want to get Levemir there, I'm going to still pay that $300 because University Hospitals doesn't pass on the savings to their patients. Metro Health does.
I see. Okay, thanks.
So,
I didn't know.
And so if you talk to somebody who's from Metro, especially, you can call Metro's main pharmacy and say, I have somebody who I think should qualify for 340B. They'll ask you for the name of the Metro Health location to make sure that they're giving you the right discount because it varies by location. And they can say, oh yeah, the price is this. It doesn't work like that with university hospitals, or even the FQHCs don't pass on the same discount. You just don't know. It's more of a discount than UH does, but you still don't know exactly what it is. Yeah. But of course, the FQHC is going to see if that person qualifies for Medicaid, and we'll try to get them enrolled in presumptive. And if they do that, their Medicaid for medication purchases should be active within 24 hours of them enrolling at the medical facility.
Okay. Okay. Thank you.
Yeah. So what else? Or do you want to just go through a couple more scenarios?
I would. I'd like to see, just to kind of get the mechanics down, you know, to kind of watch, and like what was said before, you know, to see it all kind of come together, the different options.
Okay.
If that makes sense.
Scenarios too.
Can I ask a quick question too? Oh, go ahead. When you said that if they apply for Medicaid in person, they may be eligible for their prescription assistance within 24 hours. Is that right?
Yeah, if they do presumptive enrollment in Medicaid, does everybody feel comfortable with what I mean by presumptive?
Not so much.
Okay, so presumptive enrollment in Medicaid is that thing that happened when the ACA passed, the Affordable Care Act passed a few years ago. They allowed people who were not kids, not pregnant women, to enroll in presumptive Medicaid. So you're basically presuming somebody is Medicaid eligible. So you can, there are only for certain facilities that can do that. They're called covered entities. So places that can immediately enroll somebody in Medicaid on the spot, like the expansion group, like the 19 to 64-year-olds that are 138% of federal poverty and below, that's the new group that can do presumptive. Pretty much the only folks that can't do it would be the elderly or disabled. So everybody else should be able to do presumptive at this point. Basically, you're seen by a doctor's office. You have to be seen there as a patient. You just can't walk in off the street and say, hey, sign me up for Medicaid. If you're seen there as a patient, like I'm going to go to Neighborhood Family, I have an appointment or I do a walk-in, and it looks like I qualify for Medicaid. And the doctor, you know, understands what my income is, what my medical needs are. They're going to actually put me directly into the Medicaid billing system, to the MIT system, and activate my Medicaid right away. So the doctor will be immediately able to bill anything that Medicaid covers. But normally the prescription portion of that doesn't activate for 24 hours. So if you walk out of the doctor's office and they hand you that temporary Medicaid billing number, which is just handwritten, there's no printout of anything, you try to take it to a pharmacy and it's not going to work for a day. So now and again, you would get a call and say, I just left Neighborhood Family and they said I have Medicaid now, but I can't use it. It might not be active for a day. Normally, the community clinics are going to try to get you the medication that you need and just back bill Medicaid. But that's what it presumptive is. So
that helps. Thank you. And then if they were to apply on the phone, when you also mentioned that sometimes they can get approved right over the phone, how long does it take for prescription assistance or coverage to take effect then?
It's normally 24 hours again.
Okay. Thank
And
you.
it's a great number. I think it's now like an 866 number. I think Martha may have just put that in like last week. But it's pretty exciting stuff. At least it is for me. Anybody want to create a scenario, or am I just going to make one up? Because it'll be fun either way.
Yeah, sure, I'll do it.
Okay, so what's going on for you?
Well, I just left my doctor's office and I found out that I have shingles. And so I took the prescription. He gave me a prescription for Valtrex, and I took it over to my local Walgreens, and it was like $130. And I don't have that kind of money. I have insurance, but I haven't met my deductible yet for the year, and so I'm stuck. I can't afford to pay that much for this prescription, and I'm in a whole lot of pain.
Yeah, well, I'm sorry that's happening to you. I know it can be really painful stuff. So the Valtrex that you're using, I want to check to see what kind of options we've got here. So the Valtrex you were prescribed, is it the 500 milligram or the 1 milligram or 1 gram?
1 gram.
1 gram. Do you have any idea how many it's for? Like, is it for 10 or 20?
It's for 30.
It's for 30. Okay. So when I look here at a discount card, oh, you know what? Let me ask you if you can share with me your zip code, because sometimes that can make a difference in the price.
Oh, okay. It's 44125.
Thank you. Okay. So kind of give you a ballpark here. If you were to use a discount card, it's a free discount card. Price comes back at around $25, $25.95 if you were able to go to like a Giant Eagle. It goes up to $33 if you went to Target. Do you think if it was $25 or $30, that might be something that you could do?
Yeah, I could probably scrape up that.
Okay. Now, do you feel like so you mentioned that you have insurance right now, but I'm wondering if you might qualify for a different federal program like Medicaid, someone to help you to pay for your insurance coverage. Can you give me like a rough idea of what your income looks like in a month?
Yeah, it's like about 1,800.
About 1,800?
Yeah, but I don't have any dependents or anything.
Okay, so it's just you, and income is around 1,800, and that's your gross, or is that your net? Like before or after taxes, is that?
That's my gross.
That's your gross. Okay, so well, it looks like at least for now, it looks like you wouldn't qualify for something like Medicaid coverage. Now, for shingles, let me double check something if I may here. So sometimes people use Valtrex short term. Sometimes they might need to use it a little bit longer. I just want to check to see if there's any other options that might be a better deal for you. Okay, so bear with me just a quick second. Okay, so I don't see a different program that would help in that instance. So what we could do is I can text you a discount card that would make it $25. That's probably the best that we can do. It looks like even if you went to like a discount mail order pharmacy, the price is still about the same. It's still around $25. So that might be the best that I can suggest for you at the moment.
Okay. Okay. Well, I think I can get together $25. That's
Okay,
not
great.
bad. That's a savings from what I would have had to pay.
Okay, and how much did you say it was going to cost you at the other pharmacy?
They told me it would be $140.
Okay. All right. Well, here, I'm going to text you the discount card, and you'll just take it to your pharmacy along with your prescription, and then they can apply it immediately. And, you know, if there's other medications that come up, just give me a call back, okay?
Okay. Okay. Am I able to use those coupons more than once? So, like, if this doesn't clear up at the end of the 30 days, am I able to use another coupon?
Yeah, absolutely. You can use the same coupon over and over again. You'll see it says the name of the drug, the valcyclovir, on it, but it can be used also for any other medication. And you know, if you check and see if you can come up with a 26 and you really don't think you can, there may be a less expensive alternative. If you were to call the doctor and say, I can't afford this, they may be able to come up with something that's cheaper.
Okay.
Okay. Okay. So what I was trying hard not to say is, hey, she should just call the doctor and ask them for acyclovir because it's a comparable drug, but I'm not a doctor and I don't play one on TV. A lot of times that's what doctors would do. They would just prescribe acyclovir instead because it's comparable and far less expensive. So if she were to call her doc, that might be a different route to take. So, hey, so if we're going to put that person into MedData, we're going to go to patient. Boy, the screen is tiny, isn't it? I'm old. So we can add patient. We can look to see if she's in here. She is not. So we just go over, we hit add patient. Patient says has private insurance, so she is going to be a PI for private insurance. And 1800 sounds good to me. We'll use that number. If any time this patient ID, there's a duplicate in there, it won't allow you to save it and it'll tell you to change it. So easy enough. So we're going to add Miss Molly. And if we don't have Molly's birthday, we're just going to add in.
Hey, I'm not that old.
Hello, someone else is. We're going to. Does that make you feel better? Yep. So at least you've got to have an age, so that will work just fine. And then we have a gender. If you can guesstimate race, I don't feel comfortable asking for it. Talk to Diane and see what you want to do. She doesn't have any independence, goodness. She doesn't have any dependents, so we just put her in as 1 and hit save. If she has an email address, that can be helpful for follow-up if you can't reach him by phone. So that saved it. And ignore this. This is useless. Notes, okay, so has high deductible, cannot afford. Whatever it is that you want to put in here so you know later. We don't use documents, so we're going to go to diagnosis. She has an infection. It doesn't matter if it's a viral infection or bacterial, just infection works just fine. Insurance, she has private insurance coverage. And what kind of income did she have? She made about $1,800 a month. And it is goofy, you have to hit update all instead of just save when you enter some of these things. It's just goofy, but you do. So here we're going to save and close. We've got all the information about Molly that we need. And then we're going to go back over to this tracking system, add provided medication, because we're not creating an application. We'll do that one more in a second. So we're going to add a provided med. because Molly received a discount card. We're going to go here, enter her name. The name of the drug was DISC for discount card. And then what were we able to save Molly? She said it was going to be 140, and the price that we got it down to was 26, so we're going to say we saved her $114. In order for the diagnosis to come up, you have to hit save. And then select the diagnosis from the drop-down and hit save again. So with Molly, say Molly was also calling in just so we can repeat a drug application again. So if Molly was saying that she needed to get help with Lyrica, so then we would go here to create an application, enter the trade name, which is Lyrica, select it, select it again, and then go back up to details. And what was the dosage that they were using? They were using 300 milligrams once a day. So we need 365 to get through. Sometimes they come in capsules, sometimes they're in different things, so sometimes you have to choose the unit. MedData also includes instructions here, which are not particularly good. They're kind of a bit of a mess. You can use those instructions. I still pulled them off of Needy Meds because they were actually clearer, because Needy Meds formats them in a wacky way. Putting back in Miss Molly's name. We hadn't selected a doctor for Molly. She doesn't have a doctor, so we're going to enter none. She went to the emergency room because she needed to get the Valtrex, and then she also mentioned she has whatever she has to need the Lyrica. So we entered none. And because a lot of patients are in transition, that makes sense to enter none. Lots of people are, I lost my health insurance and they need to get a particular medication. So they're going to take this application that we're arming them with to the doctor that they go to see next. Will the doctor prescribe them the same medication? They may. They probably will, but they may not. But at least they have the applications and they feel a little bit more empowered to manage what's coming next. So here you would create an application. And again, it populates this form. You can hit print selected documents, but you still have to go back in and enter the diagnosis. So you're going to go back over here to edit record and tracking. Go back down to select the Lyrica. And infection is the only one, but we know this is not for an infection. So we need to add another diagnosis. So we're going to go to patient profile here. Back over to diagnoses and add pain inflammation. Insert. And back over to history where the Lyrica is. Select it. And that's that. So we can see we've added Molly, we added a few to Jackie, and of course Bill. Anybody have questions? Anybody want to create a scenario, or should I just throw one out there?
Could you do a scenario of somebody needing like a really expensive acute medication that they needed right away, that maybe a discount card wouldn't help?
Like, what are you thinking about?
I have no idea. I can't think of a specific medication that would be, I don't know. I'm just thinking like somebody that, you know, mailing in something or paperwork would take a long time. What do you do in that situation?
Okay, so let's see.
These are really
so
once, Adrienne, that was like an HIV one that was really good for that.
Oh yeah, that's a good one. So, let's see, what was the drug? Try something. A Tripla, I think.
I think it was Truvada, but whatever you have that works, that was a good example.
Okay, so a triplet, so someone, I mean, this has unfortunately happened before when someone has been exposed to HIV and they need to do post-exposure treatment. And so the one example that I had was a kid that he was 20-something, was on his dad's insurance, he was exposed to HIV, he went to the pharmacy to pick up the medication thinking he was gonna have a $50 copay, and he did not. His dad had canceled the health insurance coverage without his knowledge, and he was stuck. And he didn't know what to do. So with whether it's Truvada, or I think that works for both. So this stuff is not dirt cheap. I think normally you would only take a short course of it, but still not dirt cheap. So if you need several $100s for medication, you'd be in a bit of a pickle. So what you could do if this was Truvada, let me find you in there. So of course, when you've been exposed, you need to take the medication as soon as possible. So he didn't have days to figure this one out. So something like Truvada, you go to the drug company program in Needy Meds. Oh, let's see. This one. Yep. So there's a copay foundation. Copay foundation won't work for him. Truvada for PrEP. That's for preventive purposes only. So I think that's the PrEP, isn't it? Truvada for PrEP, which is I thought it was post-exposure, or is that pre-exposure? It's prophylactic exposure. Oh crap, I forget. Anyway, whichever one it is, you can use this company in order to get help with the medication. You simply get them to call this phone number. What I've done in the past is just make the call with them. Naturally, you don't want to let them go and say, okay, here's a number. Good luck getting this $1,800 worth of medication. Hope it works out for you. You make that three-way call, you get them enrolled, they ask them a few questions. You can stress to the representative that this person has been exposed, they need help with the medication, and it takes just a few minutes to get them authorized. They give them billing codes over the phone so they can immediately pick up the medication at the pharmacy, and it saves them gobs and gobs of money and stress. So assuming that we had sent that fella out, we were able to get him enrolled, and he was able to get $380 worth of medication. Again, we would go back and simply add him into MedData. Do you want me to go through and add a new patient, or do you feel like that one's intuitive?
No, I think that's intuitive. That's good.
Oh, good. Thank goodness. I'm like, I think it's just so easy. You're still just entering people and the drugs. And then for this one, it would be the drug company application itself. So you would just add it like you normally would. Whoops. Here we go. And you go through the steps from there. Does everybody feel comfortable with this part of it?
Is there a way to, kind of log into this and just kind of click around and get used to it? It makes sense when you're doing it, but I just wonder, going fresh, what it's going to look like.
You can do all kinds of stuff. Once I can put you guys in, Chris can throw them in, whatever works. And then you can go in and fiddle around in there and then delete everything. So you can create people and then delete the people. Normally, I mean, Chris or Molly can set those rights for you. So like the people here that I've stuck in, you just delete them.
Yeah, we can do that. We can,
Yep.
we'll add them.
Cool. Then you
Molly,
can go.
yeah, we'll put them in.
Yep.
Thank
So then
you.
you can go in and do all kinds of good stuff, and it won't matter. Anybody else have questions? Okay. All right. Do you feel like you have an understanding of what, like, the Medicare Part D coverage gap or donut hole is? That's an important one.
Not really. Would you mind going through it again?
Okay, so I think I understood some, and then go through it again. So let's wing it. So just in the basic terms, that Medicare Part D is the drug coverage. And when Congress created this years ago, they created a gap so that patients had to pay around $3,500 worth of medication. That is, between them and the insurance company, they had to spend about $3,500 in medication, or could spend up to $3,500 in medication, until they hit the coverage gap of the donut hole. So sometimes you have, I'll back up a second. Sometimes you have a deductible with your Medicare Part D plan. Normally it's only up to about $400. So you may spend up to about $400 before your coverage kicks in. Then between you and the insurance company, you incur bills for up to about $3,500 worth of medication. Patients paying the copay, the insurance company's paying the lion's share. Then you get to the coverage gap or the donut hole. And then the patient then has to spend about $4,000 on medication again before they get to catastrophic coverage. So in the donut hole, your prices may double or triple. So to give you an example, if after you've met your deductible, you have a $45 copay for your Levemir, your insulin. Your insulin, we'll call it $300 a month. When you hit that coverage gap, it's because you've spent more than $3,500 on medication between you and the insurance company. So you then, for every brand name drug that you need, you have to pay about 50% of the cost. So you had been paying about $45 a month, and now you have to pay $150. And you continue to pay those higher prices until you have spent $4,000 or incurred $4,000 worth of medication costs. And it sounds like a big number, but if you're using 2 different kinds of insulins, you have multiple chronic health problems, you may well get to that coverage gap. Some people get there and stay there because they don't have the extra $4,000 to get them out. If they were to get out, they had enough money to pay the additional higher costs, then they would get to catastrophic coverage where you have minimal co-payments. But a lot of people just end up in the coverage gap and then they stay there till the end of the year. So if someone has health insurance through Part D and they get to the coverage gap, they could get help with medication through some of the drug companies. The rules on Needy Meds should tell you which ones they can get help with and which ones they can't. Most now you can. There's also those national foundations that will help people who are in the coverage gap, the drug repository, discount cards, pretty much anything. The only thing that Part D enrollees can't really access would be copay discount cards. So, the company that makes Levemir has a copay card for people with private insurance. It takes like $100 off of a fill. You'll see in the fine print, if you're a Medicare enrollee, you can't use those discount cards. But so for this scenario, someone who is looking for help with Levemir, they could apply for a drug company program to see if they could get help. You would also want to screen that particular patient to see, do they look like they qualify for that extra help program? Because extra help is that Medicare program that would helps them to pay for coverage, eliminates the coverage gap, helps to pay for the deductible. But assuming that they're over about 150% of the federal poverty level, then they can go through a drug company program, assuming that works, that the drug company allows it. and then they can apply for help. They'll receive the medication in the mail at the doctor's office or at their home, and that's how they get through to the end of the year. If the patient's using a generic drug that's not available through a drug company, normally Medicare is going to pay, I think it's 20 or 30% for this coming year, and then the patient pays the remainder. Still may have copays that are too high that they can't manage. May be cheaper for them to use just a discount card or the drug repository or something else. There are circumstances where using even a GoodRx discount card makes more sense, but you can actually use GoodRx to see which one would be cheaper. That's kind of a crappy example. Let's try again. Oops. And the computer is going to take a nap. Okay, well, we'll use this instead. You can actually add your Medicare plan here. And I have found in past that these were relatively up to date. So you could select which plan you're using. Okay, so it's not an Advantage plan, it's a Medicare Part D plan. And then you can select which one it is. So, you know, one of those really popular ones would be, this is not ciphering here. Let's do this here. Not cycling those out. Okay, well, we'll call it the Express Care. And I'm in the coverage gap, and it sets my plan. It will then tell you how much your medication would cost you in the coverage gap if you went to a specific pharmacy. Some medications are cheaper if you use GoodRx and some aren't. But this should give you an idea. Unfortunately, a lot of times people don't know which one is their Medicare drug plan. Really just ask them to get the card out and read it to you. And of course, with this conversation, if they have high copayments, if their drugs aren't covered or whatever it is, naturally, this time of the year, they would want to look at other insurance plans through Medicare, so they can call, you know, of course, OSHIP to have them look through one of the other plans. And because the plans change every year, the drugs that are covered change every year, the prices change every year, they should always check around about every Halloween to figure out if the plan that they're using is the best plan for them. Any other thoughts?
I have a thought. Can we end now because I'm starving?
Well, you are the princess in control, so good. Okay, so
I'm dying. So we're on again tomorrow, and then I think maybe what we can do is just after that, just kind of play around in MedData, and then we'll meet one more time just to address any questions that we come up with.
I have a question. So I think it might be pretty clear that I don't know if you guys are going to have time to look through MedData between now and tomorrow, and I wonder if we should cancel the session for tomorrow to give you some time to play around, look at those instructions that are there so that you can kind of have more pertinent questions, or, you know, it's not just me rambling and wasting your lives.
I'm okay with that if everybody else is okay with that.
I'm all for that as well.
Yeah, right. I think, yeah, looking at those instructions, I think you'll see it's really clear what you got to do. And, you know, yeah, let's circle back. And if you can come up with some scenarios, walk through them. And if you get stuck, you know, you can shoot me an email or give me a call on my cell and we'll figure it out.
Okay.
Why don't we, Molly and I can maybe send out scenarios to Maritza and Katie and Christy, and then we will make sure to get everyone added to MedData, AKA Patty Cake.
Patty.
Patty Cake is the true name of the company. I know this because I used to pay the bills, and Adrian was like, "What? What's Patty Cake?" But anyway, it's called Patty Cake Services. So why don't Molly and I sign everyone up, let everyone go explore for a little bit, put out some scenarios, and then we can regroup. Molly, does that sound like a plan?
I am totally down with that. Sounds
Yeah,
good.
I think that will make a lot more sense. And come up with wackadoodle things for people with Medicare, private insurance, public insurance, ask your family and friends, and then solve their problems.
A little bit of everything.
Okay.
Got it.
And then we can talk about the Medicaid, the poverty level, you know, calculator and all of that with these guys.
Okay.
All right.
And if you know,
Okay, so we're off,
oh, I'm sorry.
we're off
If there,
to
if there are specific topics that you want me to cover in depth, great, happy to do it. Or if you want me to just find, you know, if there's a specific topic, whatever it is, cancer treatments or whatever it is that you want to have more in-depth information on, just shoot me an email and I can send you the links and then we can go over it if you like.
Awesome.
Yeah, and that's great. Thank you. And Molly and I can, if these guys have any of those, they can shoot Molly an email and then we can talk about it and then Molly can discuss it. Let's just make Molly the main point of contact for this, and then she can go to you, and then we could be, you know, more prepared next time. Sound like a plan, Mo?
Yep, sounds good.
Hot diggity dog.
Are there any other, I know you had emailed that cheat sheet. Is there any other, you were mentioning something about a MedRefer folder, anything else we should be reading up on so I can be prepared for the next one?
Honestly, that have you, I think once you look at the instruction sheet, I think it'd be pretty clear.
Okay. All right. Thank you.
Katie, take your time and look it over, and then just email maybe Molly and CC me if you have any questions.
Okay, sounds good. Thank you.
And if you guys need to, just like if you're looking it over, everyone should be logged into In Contact and training and clocking into Chronos, so all your time is marked. So if you want to do that on your own, just make sure that you clock into Chronos and then go into training meeting and In Contact, and then we'll know what's going on.
Okay, sounds good. Thank you.
Oh, you're welcome. All right. Thanks, Adrian.
Yep, you bet. Y'all have fun.
All right. All right. Good night, everybody.
Bye.
Bye-bye.
Night. Thank you.